Hello and welcome to the Valley. Today I am your host, Janet Michael. It is Community Health Day sponsored by Valley Health. Every month we meet up on the Zooms typically with someone from Valley Health to talk about a health issue. Today I have the privilege of sitting in the corner office. This is the corner office, right? Ish. At Winchester Medical Center talking to Dr. Jeff Feit, and his title is just so long. Hang on, let me look at his name tag here. He is Valley Health System's Population and Community Health Officer, but you are also the Medical Information Officer. Is that right?
Yeah, that's right. It's good to be back with you.
Thank you for talking with me today. I understand we're going to talk about a topic that we talked a lot about just a few short years ago, which is immunizations and vaccinations.
Yeah. So in my past life, I was a family doctor down in Luray and did a lot of work with families, adults and children, and talked about vaccines all the time. That's part of the work we did, just to help them take care of people.
And this is National Immunization Month, which I'm guessing is a time when everybody should take some time to educate themselves on vaccines and immunizations and why they're important.
Sure, I think that would make sense. I think with everything that happened during COVID, everything got highly energized.
Bonkers?
And, it was a time when we were all being given a lot of new information in a time that felt like it was really high stakes to understand that information correctly. And nobody likes to be told you have to believe this or you have to do that. And so maybe it's a good time to reset. So we have been vaccinating people for a long time. So the smallpox vaccine was the original vaccine story. Where we realized that we could intentionally give people a disease called cowpox, and their body would build up immunity not just to cowpox, but also to smallpox, which was a leading cause of death at the time. And off we went. And so everyone was vaccinated for smallpox, and smallpox is eradicated now. And it was eradicated because we vaccinated people. And then other childhood vaccines came along, the measles, mumps, and rubella vaccine, the diphtheria, tetanus, and pertussis vaccine. And these vaccines are all incredibly effective at reducing the number of people who die from those illnesses. I was looking this up, I'm preparing for this conversation today, and if you look at there's a website called Our World in Data, which is just, they're not making any judgments about the data, they're just saying here's what the data is. And 150 million children have been saved by vaccines in the last 50 years. This is all pre-COVID, this is not about COVID, right? This is about measles for the most part. The number of people who have been saved from measles in the last 50 years is over 93 million people worldwide. And that's because
it's crazy.
It's a crazy number. And it's every continent. It's around the world. And we're lucky now. I think we're a little bit jaundiced in the sense that we no longer see measles every day, and many clinicians have never seen a case of measles. I don't think I've ever seen a case of measles.
Really? We were talking about that before we started recording when I was trying to remember if I had chicken pox before, and I remembered having something, and then we realized it likely wasn't measles because I was born in 68, so I would have been vaccinated against the measles.
And I was born in 68 as well, and I was vaccinated too. And so there's some of these diseases it would be hard for even most clinicians today to recognize because we don't see them anymore. It's funny, whenever I think that way, so I went to medical school between 91 and 95, and I was taught in 1992 that young children, when they come into the hospital, to the emergency room, with a condition called stridor, and kids who are stridorous, they're a little different than kids with asthma. Kids with asthma lean back and they try to open up their lungs and they wheeze. They have that high-pitched, that noise, which I don't know if I've come across on the radio. No, they have this high-pitched noise where they wheeze, and that's asthma, or it's in the very small airways down in your lungs. Stridor is a raspier, deeper noise, and those kids hunch forward because they're trying to open up the top of their airway. It's a sign that we associate with a disease called epiglottitis. Remember, the epiglottis is that little flabby thing that projects your breathing to you when you're swallowing. And if you get an infection of your epiglottis, that can block off your ability to breathe and you can die. And those kids lean forward and they're just trying to open
Trying to stretch that and get some sort of gap.
And the number one cause of that disease was a bacteria called Haemophilus influenza type B. And I was taught this in 1992, and it was a major cause of mortality for young people, especially older toddlers. And the vaccine came out for that disease. I haven't looked this up, but it had to be 92 or 93, right around that time. I never saw a case. It went from being one of those tests on all of our boards. It was a common thing that everybody in Central Virginia, I went to school at UVA, so it was the kind of thing we saw all the time, major cause of hospitalization and death. You got to know it. You got to recognize it. You got to save that kid's life. And I've never seen a case of Haemophilus. I've seen one case of epiglottitis caused by something else, but the vaccine came along and just wiped it out.
Wow.
Yeah, it's amazing. And then hepatitis B and all the other things we've seen over the years. And For the most part, non-controversially. I think that's one of the things that we all are shaking our heads at a little bit here is so many people's lives have been saved by vaccines. So much disease has been prevented. We're so lucky to live in a world where measles and mumps and pertussis and diphtheria and those diseases, the disease that causes epiglottitis, no longer happen.
I had no idea that there were as many vaccines as there were until I had a kid. Because, of course, when you're a child, you have no idea. Your mom's just taking you to the doctor, and he's sticking a needle in you, and you cry for a little bit. He gives you a lollipop, you go home, and you don't remember anything about it after the fact. But now I'm taking this kid in, and then progressing through his life. Chickenpox vaccine became a thing when Josh was little, and then it's time to send him off to college. And I thought I had been very good about keeping him up to date on all of his things, and it turns out he didn't have some meningitis vaccine that he needed to have in order to live in the dorm at college.
It's a really interesting point. So I think we went from one category, which is diseases that lots of people die from. Measles is a disease a lot of people died from. And being able to prevent that was really important to us in this sort of big way. And then we went to things that were a less common cause of mortality, but seemed horrific when they happened, and if they're preventable, shouldn't we try to prevent them? And so meningitis is a good example of that. You don't remember meningitis because when we were kids, that vaccine didn't exist. I don't know the statistics, but it's a couple of thousand. It's not millions of people. But 1,000 or 2,000 times a year, young, healthy people will die in 48 hours from meningitis.
What?
Yeah, it's a crazy, fast disease. And because it frequently happens in living places like dorms, it reasonably creates this incredible surge of anxiety when it happens, because who did I talk to and who did I share a water fountain with?
Much like the COVID days.
A little bit, yeah. And it's super contagious and it's super deadly. And so the thought was, even though it's not a common cause of death in 20-year-olds, it happens. And if you're going to send your kid off to live in a place where it could happen, shouldn't we?
An ounce of prevention.
And so we increased the number of vaccines, and we added the chickenpox vaccine. And that's, why are we preventing a mild, harmless illness like chickenpox with a vaccine? Because if you somehow escape childhood and get it when you're in your 30s, you get really sick. Mm-hmm. We said we can vaccinate for that. And then now we have the HPV vaccine, which is super effective at preventing cervical cancer.
Which also wasn't available when I was a kid.
Right.
I don't know that it was even necessarily widely available when Josh was at the age that they recommend that you get it.
But now it is, and now cervical cancer is thankfully much less of a common thing that happens. So I think there's the conversation about the basic childhood vaccines and how important they are to public health. And some of these diseases, measles and pertussis, are so contagious. And then there's the conversation about, does anybody want their kid to be exposed to meningitis in college? And I think those are good conversations for people to have about what's important to them and their families, and do they create risk for themselves, do they create risk for others, and all that kind of stuff. But I don't want to lose sight of the large numbers when it comes to these big childhood diseases and how lucky we are to live in a place where measles is still an uncommon disease. It's unfortunately coming back a little bit in communities where vaccination rates are lower. But these were incredibly deadly diseases that just killed tons of people.
Fun fact. Years ago, Josh was a baby, 6 months old, I think. I was a member of the local Kiwanis Club, and we spearheaded the Kiwanis International thing that year, or for that decade, was immunizations. So I teamed up with Kathy Narangis, bless her heart, and we created an entire campaign around immunizing babies while they were here at Winchester Medical Center. Oh. I don't know that it was actually this building. It might have still been the other hospital. We brought Linda Robb, who was married to the then governor, Chuck Robb, to town. Betty Bumpers, her husband was a governor, I think, in Arizona, and Rosalind Carter. Oklahoma. They all came to town, came to the health department, which used to be over on Commercial, I think it was Commercial Street, and we had this big thing where we were talking about immunizing our children. This is actually how Josh got his shots, because he was the only baby that all of us on the committee knew was of the age that needed them and was accessible. So we did magnets. We had these magnets that were created. I still have one literally to this day on my refrigerator. There was a little business card magnet, and on the left-hand side it had the dates and the type of vaccines that you needed to get your child, and the same on the other side. And then you could pop the center out of this magnet and put your baby's picture on it. So the nurses in the mother-baby unit here at the hospital would do that ahead of time and give them to the new moms and put them in their little bags that they sent home with them to make sure that they remembered when their kids needed which vaccines for what, and they got to see the little picture that you always got taken here at the hospital of the babies. So there you go. Fun fact, Josh screamed and cried the entire time. Mrs. Carter held him, and I was mortified. I'm like, I am so sorry. He's usually a very quiet baby. He's been asleep all morning. She goes, oh, please, honey. My kids screamed when I held them too. And I'm like,
so sweet.
Oh my gosh. And for years, she sent me and Josh a Christmas card. For years afterwards. But it was a thing. People needed to be educated on it, and I feel like we've come full circle because people still need to be educated on it because it's not the same as it was. In some ways, it's even more important and more valuable. How much has our population increased in 30 years?
I think you're right. Let's go back to the beginning of how vaccines work. We were talking about this a little bit before the show. So I think it's easy to confuse a bunch of similar things, right? So there are medicines that you can take to prevent something, right? We give our dogs heartworm medicine to prevent heartworm. We give them a medicine to get ticks and fleas, that kind of stuff. That's not a vaccine, right? A vaccine is something we expose people to, usually a shot, but there used to be oral versions too sometimes. And what we're trying to do is convince our body to build up an immunity to something, to build up an antibody or a way to attack something when we're exposed to it. So back to the smallpox, cowpox story. So once people were exposed to cowpox, and that was the observation is, hey, those people who got cowpox, they didn't get smallpox. Maybe we should just give everybody cowpox, right? And so that was a way that we were able to do that. Let's talk about polio for a second. Polio vaccines initially were oral, right? The oral polio vaccine. Mm-hmm. And when I was in residency, we still offered people oral polio vaccine, which was a live vaccine. It was called a live attenuated virus. So they took the polio virus itself, they tried to weaken it as much as they can. So they created the wimpiest polio out there. And they said, hey, if you expose yourself to this really wimpy polio, 99.9999% of you will not get polio, and you'll never get it again because now you've been exposed. And there was a big campaign to eliminate oral polio vaccine when I was a resident, because as unlikely as it was for someone to get polio from the oral polio vaccine, it still became the number one cause of polio, because the other polio vaccines prevented everybody else from getting polio, right? So getting wild polio became impossible. And it was the very few people who got it from an attenuated oral live vaccine. And so that's why we no longer have oral polio, and the polio shots prevent polio 100% of the time, and you can't get polio from the polio vaccine.
I did not know that.
So that's an example of both how we moved from something which was way safer than it used to be to then making it even safer. And I don't want to give the impression that lots of people got polio from the oral polio vaccine. It was a rare event. But if you get inactivated polio, you can't get polio from it. Much like you can't get COVID from the COVID vaccine.
You couldn't get polio.
So you can't get polio from the inactivated polio vaccine, but you could get it rarely from the weakened polio vaccine. And most of the other vaccines we see today are not live vaccines. They're what are called antigen vaccines or these mRNA vaccines. And you can't get the illnesses from those because there's no there's no whole virus or whole bacteria in those vaccines.
Do you think there's a breakdown in that understanding from, say, my parents and my grandparents who know vaccines traditionally carried the live virus to today when they don't? They just don't know that they're different, therefore they're safer, and there is no correlation?
That's a great question. I think, boy, now we're going to move from medicine to philosophy really quickly. Right?
Don't we always? You and I always end up doing that in some way.
I think there's a breakdown in people's trust in institutions broadly. And I think this is one of the unfortunate consequences of this. So if we're talking about vaccines broadly, there were two things that people worried about. The question about autism and the MMR vaccine has really been disproven. It was
over and over again by multiple people in different countries.
Right. And the person who wrote that article was published in The Lancet. He was a British author many, many years ago. And that paper simply been discredited. They thought their report is looking back at those patients it wasn't accurately reported. It's not that. Sometimes in science you learn something and you say, wow, we looked at that the wrong way, let's redo the experiment. This isn't even that. They just thought he got his data wrong. So that's unfortunate that that's really lived with us. We've had a huge increase in autism. It's tragic. It affects a lot of families. It's a real thing. I have in my family, there's autism out there, and there's a lot of autism. There's just no evidence it's connected to
vaccines.
There just really isn't. I think it's hard to say to folks who are struggling with an illness that's growing in our community and who think they have an answer as to why. I want to validate, hey, lots of families struggle with autism. It's an important disease that we're all looking at and careful about. There's just no reason to think that having those kids or other kids exposed to diseases like measles does anything to fix the autism crisis.
And I think that's a really good point, because not having that definitive answer of what actually does cause autism makes people be more open to randomly attaching themselves to any other possibility, to just have that closure, to just say, this is what I can point to, whether it's correct or not.
And then I think the COVID stuff we talked about earlier, I think that was a challenge. It was a new technology and a new vaccine. There is tons of data that if you look at the different countries and how well they did with COVID, the more vaccinated were, the fewer people died of COVID. I don't have any question about that, and in large numbers. Were there real side effects? Sure. The myocarditis stuff was real. It was rare, but it was real. But linking any other meaningful side effects to the vaccine, super rare. But, I mean, millions and millions and millions and millions of people got COVID vaccines, and we just didn't see any side effects from that. In large numbers, we certainly see individual side effects. So I think it's tough. And I think COVID was tough because it was new, but a million Americans died of COVID.
Right?
A million. 1 out of every 320 Americans died of COVID.
I know people that died from COVID. I know no one who has died from measles. I know no one who has died from polio. I don't even know anyone who has grandparents that had polio. There's something to be said there when you just stop for a minute and think about it. And COVID was different.
COVID was different in a couple of ways. So it was a disease that lots of people were dying from. And it was a disease where we quickly moved to say, hey, if we can get a level of immunity, even if it's not perfect, that allows people to get COVID and not die. Once you've had it, the next time you get it, it's less dangerous. And so we all talked about herd immunity. Mm-hmm. And herd immunity was this combination of vaccinated people and people who got it. And now we've gotten to herd immunity, right? And it's very rare now for somebody to get COVID for the first time who's never been vaccinated.
Right.
And so now when we say people aren't dying, people still die from COVID, but they don't die in these gigantic numbers. It's that herd immunity, right? It's that everyone has had some sort of immunity event, whether that's a vaccine or the illness.
And again, Josh's generation, his kids' generation, they're going to look back and say, of course we're going to get a COVID shot. It's what we've always done. It's like I did when he was, okay, yeah, of course we're going to get the measles shot because that's what you do. I'm wondering, though, did that first generation, did they have this public outcry against a measles vaccine like a lot of the country did about COVID?
I think it's hard not to take things for granted that you're born with, right? I look at things like clean water. We counted on you and I are the same age, right? So we've counted on the government to ensure that we have clean water. When we see failures like we saw in Michigan a few years ago where the water was no longer safe, like, how can that happen in 2025 in America? Well, it didn't happen for several decades because we invested in public health things like clean water. And that's because our parents and our grandparents' generations used to live in a place where they didn't always have clean water. And we had lead poisoning, and lead poisoning was a crisis. And so you get through the crisis, you make the changes to avert the crisis, and then 2 generations later, people forget there was ever a crisis. And so it's a little bit of this history repeating itself if you don't remember it. I think that there's a little bit of that going on. I think that if people could talk to their great-grandparents and say, hey, tell me what measles was like when you were growing up, and they all knew people who died of measles, then they'd be able to say, hey, you probably should get your kid vaccinated for measles because I knew a lot of people that died from that. And right now, I think some people are playing the odds, right? They're saying there's so little measles around, what are the odds that my unvaccinated, I can win both ways, right? I can avoid what I perceive to be a risk from a measles vaccine, and he's not going to get measles because there's so little measles around. But that won't last for long. Measles wins.
Yeah.
Right?
Well, I remember asking you at one point when it was all you were seeing in the news, should I get like a booster?
For measles.
Because I was concerned, having not had one since I was a child.
Sure.
I'm at the opposite end of that spectrum. I don't want to take my chances getting anything that might kill me or my husband or anything like that.
I think that's right. And I think we may have to look at who needs boosters for what. I'll give you a funny story. So an opposite story from that was, so we used to only vaccinate kids for pertussis because whooping cough is really much more of a dangerous disease in young people than it is in older people. Whooping cough, pertussis, has lived in people in their 30s, 40s, and 50s for decades. It's not, I had a partner in my medical practice way back in the day who was, I think was probably 50 something back then. And yeah, when he was coughing for a few weeks, I was like, I think you have whooping cough. And he did. And that wouldn't be terribly uncommon to get a bad 6-week coughing disease. It was unpleasant, but it wasn't life-threatening. The problem is he has kids, he has grandkids, he sees people in the supermarket, and he doesn't know that he's spreading a very contagious bacteria. So we actually switched from only vaccinating kids against pertussis to trying to vaccinate everybody against pertussis in the last 15 years to try to prevent kids who are unvaccinated because they're too young from being exposed to pertussis from unwitting adults. And one of my colleagues here recently had a grandbaby. There were rules in his daughter's house. Hey, you better go get that pertussis. You can get a pertussis vaccine, and you can see your grandson.
Or
you cannot do this.
You cannot and not.
Right. And there's rules. And so we have to keep learning. We have to keep having an open mind about truth. And truth is complicated. And it's not unidirectional. And nothing is 100% safe, and nothing is 100% evil. But the truth is, 150 million kids were saved by vaccines in 50 years. And that is true. It's also true that rarely people have side effects from things. And our ability to think about those things quantitatively, to balance the size of effects, is
Right.
really part of why we need experts. So we go back to this erosion of our belief in experts and who really knows stuff. And I think, a little soapbox, I'm getting older. It's hard to watch. People go to medical school for 4 years, they do 3 years of a residency, they practice medicine for 15 years, but somebody's got a podcast. And I think how we choose our experts and how we choose to believe in and how we use information we can easily find online and bounce that information off someone who's got experience and knows how to process it is what we're all going to have to learn in this data-filled world.
Are there places, and you may not be necessarily, no offense, the best person to ask this to. I have a lot of conversations, for example, with the master gardeners and the extension office. All of the things that they tell you is research based. So when you ask them about getting rid of a pest, or you ask them about when Karen Poff does her financial management classes with me, everything that she tells you has come from research based institutions, organizations, colleges. Are there places that you should go to first?
Well, Facebook and Twitter are probably not great places. I'm not either one anymore, so it's easy for me to say. I don't think those are good places. It's a great question.
As a doctor, what do you tell people?
Let's do that first. I can talk about what I do, and then whenever I go to look something up on someone's behalf or on my own behalf, I'll do the same search you'll do, and then I'll type in NCBI at the end, and that'll get me to pull up the actual studies. But part of that is I went to school for a long time to learn how to read the studies, right? And I interpret a lot of information myself, and I know the difference between a meta-analysis and intention to treat analysis. So I think being able to process some of that literature on your own helps. I think the Mayo Clinic and the Cleveland Clinic, they all have really, WebMD, I think those are all the basics, right? What you're going to get from those places is standard of care, the regular,
generally accepted
stuff. I think looking at the big hospital systems, they frequently put up big stuff. Valley Health puts out some stuff, but not as much as the Mayo Clinic or the Cleveland Clinic or something like that.
And this almost comes full circle to almost every conversation that I have with Valley Health. Is it also comes down to your relationship with your primary care physician. Because in theory, like, you're not my primary care physician, but you're still the guy that I call and say, hey, Josh was just diagnosed with type 1 diabetes. What does this mean and how is it going to work? Because I trust what you're going to tell me. If you have that trusting relationship with your primary care physician, they're your go-to. They're your internet. Because the other perk to that is they also know your family history. Yeah. They know what the other factors might be that the internet's not going to tell you.
Yes. Yeah, that was really good, Jen. So I think I'm a family doc, and when I practiced full-time, I was a country family doc. I deeply believe in the importance of those relationships. I think it makes a big difference. I'm going to bring you back to vaccines, though, because I think that's an interesting comment when it comes to vaccines. Part of the joy of life is that between the ages of 5 or 7 and 25, you are mercifully rarely reliant on an expert for medical problems because most people just don't get real sick. And if you're going to get real sick with something, you're going to end up in a hospital and have
more medical information than you can use in a day.
The challenge with the vaccine stuff is it's advice we all need from a trusted source at a time when we don't have lots of other good reasons to lean into a trusted source. So I think if you have a pediatrician or a family doc that you work with your child and do all your wellness check stuff, I think I would pick somebody that you have that trusting relationship with. And I know all the pediatricians around here feel very strongly about the importance of continuing to vaccinate people. And I would encourage people, especially first-time parents, to find a pediatrician or a family doctor they like who takes care of their child and develop some of that relationship. But I do think that's part of where, for this particular problem, because it's a time in life when people don't have lots of other needs, once you get into your 40s and 50s and you start to experience life-changing illnesses, you have a doctor. And if you're lucky enough to get to 55 or 60 without having one of those, then maybe you don't. But as soon as you hit that first, is this going to be okay? Then you find somebody you trust, hopefully. You find somebody you trust and you build that relationship, and I do think that's critical.
So as a 55-year-old woman, should I be looking at getting something else? Is there something out there I don't know about?
So we talked a little bit about the shingles vaccine.
Yeah.
Shingles is a good one.
Shingles doesn't care.
Shingles doesn't care. Shingles is an awful disease. It's not for some people it's inconvenient.
I have a friend who actually had shingles, and it was the most horrific thing she has ever been through.
Yeah, shingles is a terrible disease. Now, if you don't get a shingles vaccine, are you going to likely endanger someone else? No, probably not. You can shed chickenpox virus, and somebody who's never had chickenpox can get it. But you're unlikely to hurt someone else. But you could lose your eye, or you could...
Wait, what?
You get shingles in your eye, you can lose your eye. Shingles is a bad disease. So
I've only ever seen it on like shoulders and the bottom part of your back. It can get in your eyes. Great.
Any nerve ending. I think these diseases will continue to teach us about the importance of science and about how we need to take care of ourselves and each other. Public health is hard, right? Because it forces us to rely on one another. It force us to do things that are not just good for us, but good for our communities. And so I think vaccines continue to be interesting from that point of view as well.
I wish there was a vaccine for that could make people care about their communities. Can we work together and formulate something? Some people I know would call it bourbon. But that's not as widespread or as useful either in a lot of situations.
It does not get rid of measles.
Thank you for taking the time today.
Yeah, it's so nice to see you again, and I appreciate you covering this. It's an important subject and one that we should keep talking about.
I will be back tomorrow with a brand new episode of The Valley Today, a few minutes after noon. Meet me here then.